think I should have said, well, I think it would be better for Courtney, Val, and me to work together, and Greg is not going to be permanently working with us. It would be better for him to be downstairs. But Greg was standing right there, so I'm not going to say anything in front of him. So. You can complain.
Because I never complain about anybody.
Well,
anyway,
you know, I thought
happy.
about it afterwards. I said, well, that's going to be a pain in the ass because we're not going to be able to work very well together. We'll have to take the conference room because I'm downstairs, you know. And really, Greg is the least. I mean, sometimes you want to work with him, but it really should have been Courtney, you and me upstairs working with Corey.
So do you have
now I'm just totally out of it.
I mean, it's 4 precious months, but given the fact that we've been separated as much as we have.
Yeah.
I mean, it's like. At all.
Well, I think he already.
Okay.
I don't know. I'm assuming he
just
already.
a touch after 4:30. We ready to start?
Yep, we're ready,
I don't
everybody.
have anything new. If he has not.
Everybody's here. We have one team member who will be joining us late. Tarlisha had a conflict with a hiring committee, so don't know if you had a chance. I emailed to Heidi a proposed agenda. If you had a chance to look at that and if it's acceptable.
Yes, we did.
You good with that?
Yep.
Okay. So I wanted to start this evening with 205. I have that to hand out. Let's see. Did everyone, ASD, did we get, I know some joined a little later. Does everyone have 205? Okay. I'll leave a couple more. Did those make their way down? Were there enough for everyone? Okay, good. So you'll note there's no change from the initial proposal to the packet on 205 that was just handed out. We had hoped to have the rates from PHT on the employee contributions plugged in, but learned earlier this week those aren't going to be available till Friday. So yeah, so that would have been the anticipated change, but you'll see the question marks are still there awaiting those rates. And then really want to just kick off the discussion with sharing some information about the Vera Care Center. As I think most in the group know, and certainly the ASD team is familiar with Vera, but we have now been in an ongoing relationship with the Care Center for a number of years. So wanted to give you a fresh look at where we are in that engagement. And to that end, we have Heidi Baines, who is a medical doctor. She's the lead clinician at the Vera Care Center, and she's gonna spend a few minutes. Andrew's gonna walk out and invite her to join us, and Dr. Baines will just describe, her role with Vera, what the Care Center model is all about, and just share some particulars in terms of what she engages in her practice. I don't have a lot of media. I just wanted this to be conversational and have her present to you. The one thing I did provide is the one-page handout that you would have seen when you came into the boardroom. That looks like this, that has the Vera logo on it. She's going to touch on, in her remarks, some of these scope of services examples, but just wanted you to have that as a visual reference as she goes through it. So you're here, and as we said, there's just the one mic. So,
Hello.
and this is Dr. Heidi Baines, and I just have introduced you to the group, and so I'll let you kick off your presentation.
Okay, great. Well, thanks for having me here today so I can share a little bit. Is the mic close enough?
Probably a little closer if you can. Yeah.
Okay.
So before you joined us, I was just explaining that I had provided that just for them to kind of reference as you're going through.
Great.
As Mike is grabbing the mic, the other document, I guess, that you've probably had a chance to leaf through is just to allow you to kind of see where we are with the ASD plan in the upcoming year. So this is the latest literature that has produced for ASD plan members and has incorporated within it the FY22 rates.
Okay. How's that? Can you guys hear me okay?
A little bit closer.
Is that better? Okay. Okay. I can tell that's working now.
So the
It's gonna be
other
great.
mic, you need to keep closer. If you kind of switch positions.
Oh, okay. One is the video mic and one is the for you guys mic. Okay. I feel very famous now with two mics. Okay. Great. All right. Well, thanks for having me. So I'm Heidi Baines, as Matt already introduced me. I am an ASD parent of a ninth grader, a new ninth grader.
Oh, I'm sorry.
Oh, are you talking to me?
Video guy.
Oh, the video. Okay, sorry. I am a parent of a new ninth grader at Stellar Secondary, and I've been a family physician for about 20 years now. For the last year and a half, I've been working at Vera Whole Health, providing primary and preventive care for many of the school district employees as the lead physician there at the Midtown Care Center. Prior to coming to Vera, I worked in Unalaska, Kodiak, and in Anchorage at community health centers and also a tribal health organization. During my training at University of Washington and then at Providence up here, I chose family medicine and particularly outpatient medicine because I was most interested in building relationships with people and most rewarded by seeing that small incremental change over time as we work together on their health. I loved working in a small town, knowing that the impact I had on someone's health was being turned around and allowing them to support the community through their contributions. And ASD is like that small community for me. When I work with a teacher's assistant or a food service person or one of the principals, I know that the more positive impact that together we have on their health, the more they'll be able to help our kids, and then that, of course, strengthens our community. We've been missing the teachers in this link, and I really feel how important that is. Like I said, my son started at Stellar this year, and until they started face-to-face school, he really only knew his teachers. He didn't know the kids very well through Zoom. Luckily, he's back in face-to-face school. So, and if we hadn't realized it before, this year we really certainly did. Our health and our home life and our work life are intricately connected to each other, and a pull in one direction really tugs on the others. So where we might have in years past thought we could leave our work at work if we wanted to or choose to work at home, this year we all saw how that wasn't really possible. So imagine going to see your healthcare provider and that physician or nurse practitioner has an extended knowledge of the issues you're facing at work, the stresses that the team you work with are facing, and a specialized knowledge of your schedule, your constraints, your network, and what the costs are for you to access care, both in terms of time and in terms of money. And imagine that the healthcare team taking care of you had more to gain by keeping you healthy, wasn't compensated by the number of times you came into the office, but was rewarded by how well your blood pressure or diabetes was controlled, whether you had your cancer screenings, and whether we did a really good job of connecting you with specialty care or any referrals that you needed in a timely way. Imagine that the way the team helps you achieve improved health is by actually spending time creating a relationship and understanding what your strengths are, what's hard for you to change, and esteeming you to be the best that you can be. I'm not a teacher, but I imagine this is what all of you strive to do. You understand the child's strengths and challenges and work towards that incremental change using that child's unique set of resources to get their best achievement. So imagine a system where you had access to a healthcare coach who guided you towards a vision that you had created for yourself and helped kept you accountable to your goals. So this is what we do at Vera Whole Health, and I'm here today talking with you. They asked me because the ASD staff have had such a positive experience with us and wanted me to share a little bit about what it's like to get care with us. And I'm also agreed to be here today because working in an organization like Vera allows me to attend to my patients in a way that no other primary care setting in Alaska's fee-for-service system is really set up to do. Vera's model is about getting back to what it means to provide comprehensive primary care in a community that we know and understand. So to provide that exceptional experience for our individual patients, but also serve as a steward to the population and the population's resources. We use data to inform the care we deliver so that we can better predict and customize what people need. And we use empathetic listening and esteeming coaching into all of our care and serve as care navigators for the population that we serve. So I thought a good way to illustrate some of the key aspects of our model would be to share with you some examples from one of the days that I was in clinic last week. So on Friday, I arrived at 7:30 in the morning. Well, I arrived a little before because I start work at 7:30. And my colleagues had actually already been there since 6 a.m. On Fridays, we open at 6 a.m. That's a very popular time for people to come in for fasting labs or appointments before work. So we've set that hour on Friday, and then on other days of the week, we're open until 7, so people can come after work. We start our day with a huddle. The huddle is the foundation for the day that we ensure that we're ready for you, for the patient. We try to close any gaps that we can while you're here, and we do that by looking ahead at the schedule, looking ahead at what people need, and trying to add those things on as needed or talk to people about them. There might be care that's needed that's not related to the official reason the patient is coming in to be seen, and we want to capture that so that we can be effective for the patient. We gather any documents or records if they've been seen somewhere else and we haven't seen them yet, and we make sure we have those available. Most days I have a few wellness visits. So this is the visit that's incentivized by ASD. You might hear about that later. Right now, the current plan has that the member and the spouse can receive $200 for doing a preventive health care visit. This is much more than a health fair screening that maybe some of you have experienced at some other jobs that you've been at. This is a comprehensive appointment where we focus on all kinds of things that impact their health. So habits, sleep, exercise, diet, ask about what people's goals are for the next year for themselves, and then review that biometric data in detail. If there's chronic disease or acute issues, we try to touch on those, and make a plan for future. There's ample time to discuss how lifestyle is impacting health. And then we do a warm handoff with our health coach so that everybody can be introduced to that program and see if it's something they want to take part in. The next patient I saw was somebody I had seen the week prior for shoulder pain. I was able to do a thorough exam on him at that time, and we decided to send him for an x-ray. His x-ray had come back. I called him to go over the results, and we decided to do a shoulder injection. So I scheduled that for him the next day. So he'd come in for that. He didn't have to go out to see a specialist to talk about his shoulder. Didn't have to wait longer to get that injection. We were able to get him in. I took care of it. And then, in the future, if the physical therapy and the injection aren't resolving the issue, then we can, of course, send him to the specialist. Next patient I saw was a urinary tract infection. She came in. We were able to test her urine right there in the center, hand her some antibiotics straight out of our dispensary, so she didn't even have to go to the pharmacy. She was able to take her first dose probably before she left the building and go back to her day. I had a video visit, somebody that was making the appointment for hair loss. We did a depression screen, which we do on a lot of our patients, just to kind of make sure that we're addressing different aspects of care. That had flagged as possible positive, so I was able to talk about what she wanted to talk about and then also kind of start that conversation about other issues that might be going on for her. I did an IUD insertion, another really wonderful, cost-effective thing we can do for patients right in the center. That patient now doesn't have to worry about getting pregnant for the next 7 years, so that's really rewarding. And then I had a patient who has diabetes, and her diabetes is not the best controlled. She should probably be on insulin, but isn't wanting to do that. So that's okay. We work with her, try to figure out what are the reasons she doesn't want to be on insulin, what is she willing to do, try to hook her up with maybe the healthcare coach, and some of the self-management tools that are available through Aetna, and make a plan to see her again after giving her one of her immunizations that she was due for. And then the last patient I wanted to share with you as an example was a patient who made an appointment just to go over her colonoscopy results. So this is something that usually the specialist would do. We sent her for a colonoscopy for screening. They get the results back. They tell the patient, what happened. Well, this patient had had that appointment but still had more questions. She wanted to know more about, well, what does this mean that I had these results? What do I need to do differently? How does this impact the rest of my care? And that's something that I do all the time, sort of reinterpreting or helping people connect back what they've gotten from other healthcare providers into what they need to do next. While I'm seeing patients, my team, my medical assistant is busy coordinating care. She's calling about the referrals we've made to make sure people are getting their appointments, to make sure we're getting the records back so we know what we can do next. And then also we're reaching out to people to make sure we schedule them for wellness visits or if they're due for follow-up for one of their chronic diseases. So all this is part of what we call advanced primary care, taking care of that whole person for all their types of needs with that integrated health coaching, coordinating care with other healthcare entities, and then using data to help us identify who needs care even when they're not right in front of us, so we can anticipate, reach out to them, and bring them back in. We also have the luxury, I think, as a provider, to work with a population where we are able to customize the care. So I know the population, the plan, the benefits really well for our patients, and I can more easily suggest resources for them. I know what's available outside of Vera really well for them as well. We have a service called Vera Direct, which is a telemedicine service available 24/7. It's only $5, and you don't wait, you wait less than a minute or 3 minutes to get connected with a provider who can prescribe medications. I always tell people, this is such a great resource. It's an app on your phone. When you travel out of state and you have an acute issue that you might go to an urgent care for, you can just use the Vera Direct. Or if you have a kid, my son is living out of state going to school, I tell him, call Vera Direct and see if they can help you with that issue. There's an after-hours nurse line that's integrated into our records. So if somebody calls after hours and the nurse talks with them and gives them advice, we get the record of that the next day. We take call for our own patients. So if there's something the nurse needs urgently, we'll get a call as well. And then we already talked about the work hours and the medications that we can dispense in office. In addition to antibiotics that you might need for something acute, we also carry common medications for high blood pressure, diabetes. So if we're going to change a dose or start you on a new medication, we can get you started with that first month to just kind of build on that momentum from the appointment. Our patient comments hit a lot on the value that Vera provides to them. So I just wanted to share a couple that I just pulled off of our feed actually this week when I was preparing this. My healthcare provider was flexible with the varying range of topics I provided at this checkup, and I was very pleased. As always, all the staff at Vera Midtown were wonderful, friendly, very welcoming, and caring. They always give excellent customer service. I felt well taken care of, and all my questions were answered thoroughly and satisfactorily. I love Vera Clinic staff and will keep coming back. The office is so nicely designed and classy. The room's bright and clean, and the staff is very upbeat and energized. I was finished with my appointment quickly and on with my day. Such a great group of professionals and caring people. I wish I could always be able to go to Vera Whole Health. Sadly, after I retire, I will not be able to. Where else does the doctor actually call their patient? I get such good care there. Vera is awesome, thank you. So, as a lead provider, it's just really inspiring for me to work in an organization that's really committed to value-based care and to working with patients where they're at. And having these resources without a lot of the barriers that people face to healthcare, so that I can build those relationships. And then really, like that small town analogy, I know that if I can effectively work with patients to be more empowered to care for themselves, then that energy they have can go towards what they want it to go towards, which hopefully is the job that they love and taking care of my kid when he's at school. So thanks for having me here.
I need this. I don't know if I need both of them, but
If you want to be famous.
so I appreciate that, Dr. Baines. We just we wanted to give everyone a sense of what what a comprehensive deal Vera is for folks. I had prepared thinking I'd probably need to ask you some clarifying questions, but I think you covered everything from my perspective, so I really appreciate that. We, like I said, we just wanted to kick things off with this. I know the association has asked for information related to the sort of the business relationship with the district, and we're pulling all that together. So and Dr. Baines, I think is fair to say, is a medical provider, not on the business side of the house. So probably not here to answer those kinds of things. But if there was a question about kind of what she described in her practice and what it looks like at Vera that the group would like to ask, feel free.
So I have a question. So do patients have a permanent doctor, or do they just see whoever happens to work with them? I can repeat the question. So the question was whether patients have a permanent doctor, or do they just see whoever is available? Yeah, so we really want people to have what we call a primary care provider. That is really the foundation of having great whole person care, somebody that knows you, and not even just the provider, but also the medical assistant. We're small enough that a lot of us know a lot of the patients, and if someone's not there, we know enough about them. And of course, there's the chart. But the goal is to have one primary Vera provider. One thing I didn't mention, which is really important, and I talk to people about it all the time, is that you don't have to stop going to your own primary care provider. If you come in and start having the Vera benefit, and you already have a long established relationship with somebody in the community who's in family medicine, that's great. We want you to keep that relationship. We can work with them. We can fill in gaps. We can be available if they're not available. I had someone come in last week who was having a pelvic, infection, and she couldn't get in with her GYN, but she knew me because I'd seen her for her wellness visit, so she was able to get in with me. We took care of it. We sent the notes to the primary care provider that she has in the community. We just want to facilitate that care, and like I said, one of our outcomes is the whole person healthy, and so if that whole person healthy means they have multiple people helping them, that can be okay too, So we're very happy to share records, but also try to have a primary person at Vera.
Other questions for Dr. Baines?
You use the term value-based care.
Yeah.
And I'm familiar with value-based engineering, and that's usually kind of bare bones. So could you clarify that question a little bit?
Yeah, sure. Gosh, I don't know if I have the official verbiage. So when we look at the value, we look at quality of care, access to care, and cost, all together, rather than just looking at low cost. We want it to be, obviously in healthcare, I don't ever want somebody to just be low cost. That's not, I'm not on the business side, like Matt said, but we all know. But we want to make sure that we're not compromising quality, at the expense of cost, right? Nobody wants to have the cheap version that's not doing what they need. So, yeah.
Anything else?
I think we're good. Thank you, Dr. Baines.
Yeah, thanks.
Just give me a second here. Thanks, Dr. Baines.
Yeah.
Yeah, Brian, I had a question.
So just last thing on Vera, I don't want to put anyone on the spot on the team, but we all have engaged with Vera. So if people have questions, outside here or whatever, happy to just describe my experience, and I'm sure others have an experience that they could share too. Real positive relationship, like I've said, and Dr. Baines is terrific. Just super grateful to have her in charge. So that is Vera, and like I said, that the reason I wanted to lead with that from our perspective is, in order to understand the value of the plan, you have to understand what Vera offers. So I thought it'd be useful for everyone to hear that from the lead medical person at the care center. Now, just moving on to the health benefits proposal 205. As I said, nothing changed from when we provided it as the initial proposal on the 14th. We do, have some question still as to how this proposal will stack up to whatever PHT has in mind for the coming year, and don't have that information. So there's really no opportunity to describe that. But what I would say is that the current monthly contribution that's reflected in the proposal and proposed for the 3 years of the contract is the same as what's available to other members of bargaining units who receive their health insurance benefits through the ASD health plan with the Vera Care Center component. And it's competitive in terms of the care that's offered. That care center model really, as was just described, is designed as that advanced primary care single point of contact or primary point of contact model for care coordination, and we've seen the value in that from a financial perspective that we can illustrate in more detail when we provide the information consistent with your request that we received last week. But the takeaway really is that this as set out in this proposal, there's nothing hidden here. This is the cost to current members going forward, and it's reflected, as you saw in the Benefiting You Every Day brochure. It's a competitive health plan that provides value to the members who are receiving care under it, and the good news is that rates for employees in terms of contributions have stayed flat for 4 years. This will be the 4th year, and that's also true with respect to vision and dental, which is our rates reflected separately, but same thing, no increase across the last 4 years, including the coming year with respect to employee contribution rates. So no big surprises. It's all reflected here, and really, I think some of you maybe and others who may have been listening can hear in Dr. Baines' description that this isn't like there doesn't need to be a hard sales pitch around Vera, because it really is a tremendous additive component of ASD's plan, and ultimately all the employees who are members of the Anchorage Education Association are ASD employees, and this team wants to see the best medical value and benefits for all employees, including AEA members. And I can tell you, to emphasize what Dr. Baines referenced, knowing because the benefits department is within HR under my purview, knowing that we receive calls from members who of AEA who had previously perhaps been in a different bargaining unit with access to Vera, situations where spouses, by virtue of being married to someone who has Vera access, maybe something happens in the family, there's no longer that access, and wanting to know how they can access that component of the plan. I can say that the experience across the board is positive. People like it, they want access to it, and we want to offer it. So that's really what this is about. Questions about the proposal?
No?
I got buzzed out because people told me they couldn't hear me last week. So. Yeah, I have a question, Matt. Can you explain why in E, I got the right section there, 205. Anyway, you're eliminating the period of time that employees can submit their notice of resignation by the end of March in order to obtain additional coverage over the summer months. Can you tell me how that relates to your proposal of district employees going under the district plan? Where's the connection on that, or what is the rationale for wanting to take away that incentive to get notification for those early resignations?
Well, thank you for the question, because and I'll answer it first with the simplest answer or most straightforward answer, and that is, it's addressed as a part of this proposal because it appears currently in the article. The longer answer is the original intent, as I understand it, and I don't have all the history, but as I understand it, was to create both an incentive, as you describe it, for employees to give that early notice that is of benefit to the district, so that staffing decisions and so forth can be made, but also that it's clearly an incentive for the employee who might not otherwise maintain those benefits through the summer, at least wouldn't receive the employer contribution after their final day of work, or final month of coverage in their work. So in answer to your question, why is it struck from the proposal? It is not, I don't think it's delivered on the promise in either regard, at least not as maybe was originally anticipated, and I'll explain. The district has found that with respect to resignations related to retirement in particular, that those employees have determined for any number of reasons why that will be their retirement, and so they're not particularly, in some cases we're finding, incentivized to give early notice because their intent will be to commence coverage under the state plan following retirement. And in fact, and this is anecdotal, so I don't have hard data for you, but there are some questions in our mind about whether there's essentially unintentional double coverage, and that we've heard that in some cases. And I don't know why, what contributes to this, but members who might otherwise have opted out of coverage, so let's say just because they give notice and it happens to be before March 31st, so they're eligible for that summer coverage, well, they may be counting on state retirement and health coverage with no intent at all to be covered under the PEHT, but if, depending on what the open enrollment structure is in that particular year for PHT, they might end up with PHT insurance, which comes with it an obligation to pay their portion of insurance as is contractual under the current language of the contract. So if you're on the hook for $400 a month or whatever it is for your portion of the insurance, and your intent, you wanted to give the district notice, but you didn't really need insurance, but now you're on the hook for insurance because you didn't opt out at open enrollment or whatever the case may be. I mean, I think there's an opportunity, and it happens when people end up with insurance that they didn't really need or want. And we're experiencing that this year because we have an effort underway to, consistent with the language in the contract, to remind people of that obligation to pay their portion of insurance. And we're hearing from members that, what are you talking about? The contract says my insurance is paid for in the summer, and it cleared it doesn't cover under the contractual language the employee portion of that obligation. So there's that. Also, the incentive with respect to from the district's perspective to sort of more planning around staffing, we're finding has not been meaningfully impacted because of this provision, and that is because, as I said, many of these folks are retiring. They may have announced early on anyway, that was their intent all along. I don't have a strict percentage, and would have to do, or someone would have to do some sort of a survey to understand, who did what, when, and why. Was it because of the language? Was it because of the contract? What was there some intention at double coverage, even though they're retiring? We don't have those answers, but that's a long answer to your question. But there was deliberate contemplation as to how to approach that and whether there's value. Obviously it's a district proposal, so the value assessment came from the district's perspective initially, but we also thought about some of the unintended consequences that I just explained with respect to impact on employees.
Do you mind if I?
Did you have a follow-up?
Yeah. So historically, the reason why this incentive occurred was because if somebody retired, their health insurance ended in the last day of May, and they could not get retirement coverage by the state until July. And the only time this occurred where there was this gap in a month was at the end of a school year and then in July. So those people who were retiring had no coverage for the month of June. Therefore, the incentive was put together initially by Eric Tollefson to get that information early on for retirees, cover the month of June, and then the state would pick them up in July. So there's no double coverage anywhere. Then it expanded a little bit over time to include other people who resigned, left, whatever the reasons there are, by March, also for that reason. And then they got coverage through August.
Thank you. That's helpful history. I appreciate that.
Just one other question on that. And just to clarify, the contract, the current language does state that the employee pays their portion.
Employee?
Yeah.
Yes.
But my question is, I believe the current numbers, over 50% of the bargaining unit is Tier 3. And if you're only Tiers 1 and 2 go into, roll into that TERS health plan. So right off the bat, any question of double coverage or any link to that retirement plan doesn't even affect over half the bargaining unit because that's gone away. Was there any thought or consideration about that in the rationale of alleged double coverage, which is the first I've heard of? I wouldn't doubt that it couldn't happen, but most of the bargaining unit isn't covered at all, much less worried about double coverage.
Yeah, I don't. I'm going to have to look to see how much data I can come up with, I don't know how comprehensive an answer or a story it'll tell, because it won't tell whether, for example, a retiring employee has a spouse who has coverage, and so they don't have any interest in continuing coverage. Maybe they wanted double coverage while they were employed, and now and now they've decided they don't. I don't know. I appreciate Debbie's point about the gap of a month or it sounds like then in June. That makes some sense to me, that would have been something for discussion at whatever time that the language was adopted. I just as we all know that I'm not saying it's a perfect remedy, but coverage, of course, under federal law, an offer of coverage extends for can't remember if it's 18 or 36 months under COBRA. It's a significant period of time. So, of course, the member would have to cover the entire cost of that month. But coverage wouldn't necessarily lapse unless it was the choice of that member not to continue insurance because they had other coverage or had state coverage or just didn't want to have coverage for a month or two. But in terms of the percentages with respect to which tiers folks are in, and I do know a significant number every year are retiring, and so I think it's typically around between 30 and 40%. I had the number earlier. I don't see it in my notes here, but I can bring that back. And then the remainder, I don't think I have or would necessarily have a way to mine that data with respect to what their intent is with regarding insurance going forward, whether they don't have access to other insurance or they do. I just don't have the answer to that.
Thank you.
Yep. Other questions about the proposal?
Okay. Looks like we're probably good on 205 for a little bit. We've got we have Article 407. I think we conceptually agreed upon last week. The parent-teacher conferences, it was mostly booked, a little bit of housekeeping, and then we'd like to take a look back at 423 emergency closures. Maybe might be good to take a short break. You want to keep going?
Let's take a break, but you surprised me a little bit by being done with 205, and I do have a continuing request, and that's we have to have the rates. We have to have the employee contribution.
My understanding is those are coming out Friday.
Yeah, they were promised Tuesday, and here we are Wednesday, and we have bargaining today and bargaining tomorrow, and now we're not going to be able to talk about some of the things that I think could have led to meaningful discussion, and it feels like it's a bit of a double standard. There's been plenty of requests to the district for information, and we've provided information. We're working on a current information request, and this is really all we've asked for, and we still not got it. And so it's just a continuing plea to. I feel like it's just to acknowledge the importance of this issue to the parties in any bargaining, and the district has clearly signaled that this is a central focus of its effort to bring value through health insurance plan to members that we feel they don't currently have access to, and we can't even meaningfully talk about it yet, and the article's on the table. So it's just by way of saying it's disappointing that we weren't provided the rates on Tuesday as promised.
Sure, I understand that. I understand your point, and
thank you. And we can take a break.
I've been told that you'll get them on Friday, so
okay,
we'll see them on Friday.
Okay.
Maybe just maybe just 5 or 10. What do you want? 5 or 10 minutes? Make sense?
It's fine with us.
Yeah.
Okay.
Let's-
Can
10
you give us 10? It takes us
Sure.
a couple minutes to walk up.
Perfect.
Yeah,
Okay,
all
10 minutes. Thanks.
right. And Brian, 407 and which one are we going to look at next?
423, emergency closures.
Okay.
Oh, no, in that case. Not so much. I was thinking more like a lab.
No.
No, your dog's in trouble.
My dog's in trouble. It's the dog.
It's gonna be a
Went out.
snack for whatever got the
Who
spruce
I
out.
went out in the yard and watched.
Can I bug you with something off topic,
now?
ma'am?
Yep. Should
No,
I,
that's not true. Everything's
is that
on now.
off or?
Yes, yeah, we just plug them back in.
Okay. You wanna go out there?
You going out?
Yeah.
Yeah, that's fine. Four.
But I did text her, so that's done.
Well, how am I supposed to actually come to think of it?
Well, send it to me, I guess.
Okay, and then you can.
Yeah,
come
we'll
back.
figure it out.
Okay. Looks like we're back. Thank you for the break. So, Matt, in front of on your table there should be a couple copies of 407 and then enough copies of 423 for your team.
Okay.
And you can proof 407 later if you want, whatever.
Okay.
But let's start talking about 423 here, emergency closures. So on must have been last Thursday, I suppose, the district presented their initial proposal for emergency closures, and it was they had a couple significant changes to the current book language. There was a sentence in paragraph A, and there was a sentence in paragraph B that we'll address in a bit. But with the association's initial proposal for Article 423 emergency closures, we maintained book language through paragraphs A, B, and C, and then we've added a new paragraph, D. Does everybody have their copies? Okay. So we've added paragraph D, and that paragraph reads, in the event that schools are closed for an extended period of time, for example, disaster or pandemic, AEA and ASD will work together to decide how best to deliver education to students. A joint committee will be formed to include ASD representatives and president-selected AEA representatives. The following will be mutually decided upon. First thing will be the location where education will be delivered. Number 2 would be the method of instruction, online or in person. Number 3, the schedule of the day, including playing time and lunch. Number 4, the schedule of the semester, how many classes per day, quarter versus semester. And number 5, guardrails for site-based expectations and decision-making to provide for reasonable expectations at all sites. So there's our proposal, and I'm sure we can spend time speaking to it. But first, though, I think to kind of maybe address some of the concerns that came up last week with the district's proposal. we've received a great deal of feedback from members, and there was quite a bit of conversation about it after negotiation last Thursday and whatnot. But maybe the nice way of summarizing it from our perspective might be that the district's intentions were good, but that it's a misguided effort. And from there, the characterizations go downhill quickly, ending somewhere in dumpster fire, I think. So there's a great deal of concern that the idea, the vision is optimistic and well-intentioned, but the plan is either not good or non-existent, something in that continuum. So we have a couple folks here that would like to speak to the district's two lines. And just for clarification, in paragraph A in the district's proposal, they have added language that says, or on days alternatively identified by the superintendent or designee to be distance delivery days in lieu of closure days. So that's new language. And then in paragraph B, they have new language that says members are responsible for ensuring they have all equipment and other resources necessary to perform their job duties from their selected alternate work location. So we've got a few folks that want to speak to those district additions to our current contract language. First, we'd like our consultant, Corey, to speak to 423.
Thanks, Brian. I'd like to start off by saying whatever decision is made, hopefully a collaborative decision with a lot of different input, your educators will be ready to go. Like, whatever decision is made, if we end up doing some type of online delivery, they'll do it, just like they have all year long this year, and all the other asks that we've complied, and members are out there doing the work. The issue around emergency closure, I think back to all the emergency closures I've experienced over the last 25 years. And they're really not snow days anymore. They can be, but they're weather days. We've had wind. At Muldoon Elementary, we got closed due to wind. We all know that ice is a bigger issue sometimes than the depth of snow. So is that an ice day? And then, of course, the earthquake. And so I think to what that looks like in Alaska. And it's a dynamic situation. Emergency closures are a dynamic situation that have a lot of moving parts. And so to put in the contract that your expectation, which is not well defined and is not clear what that will look like, especially to students and families, what the expectations are, is premature. But I got to thinking about, this dynamic and the experience I had this year, or the experiences I had just in the first part of the pandemic when I was still over at my school before stepping into this role. And so on any given weather day, we could have electrical outages across Anchorage. And so if there's an electrical outage in the Muldoon area, maybe Bayshore, maybe up on the hillside, Eagle River, what are the expectations for those families and students if they cannot connect? Are they marked absent for that day? Are they responsible for the content they miss? I don't have those answers, and we haven't talked about what that would look like. But in that scenario, I don't even know how to address that when members ask me those questions. Am I supposed to mark them absent? I don't know. It's unclear. We just have not thought through what that would look like. This year, and Mike, you could talk to this in more depth than any of us, but trying to support families with all the dynamics of being able to access online resources. I'm not sure we ever fully supported those families that have multiple students and needed to have multiple access points at the same time with the one household. So I have a high schooler that's going to have classes all day, and I've got an elementary student, possibly even 2 elementary students. And what that would look like to that family who struggled through a pandemic, who over months and months we tried to solve that problem, what would that look like to that family that day where at 6:30 in the morning they get notified there's no school, but all 3 of their students need to be online and they don't have the resources to do it, whether it's a laptop or whether it's internet or weather related issues. I mean, it's a big undertaking, and again, it comes back to what are the expectations on our students and families? Are they responsible for the content delivered that day? I don't know, because it's not well defined. Nobody really knows yet. I think about a teacher in the same situation. You know, it's really funny. When I was thinking about, I got to watch the YouTube last week because I wasn't here, but I was watching and I was thinking in my mind, every time I came up with a teacher scenario, a teacher doesn't have access or a teacher doesn't have their materials or whatever, it always came back to students and families that were impacted. So my question goes to, so a teacher loses internet access. What is their responsibility? They can't communicate. Maybe their power is out. They may not have cell. We have no idea. So many dynamics in Alaska. They can't really communicate with their principal. Their families have no idea why they're not showing up to some type of online expectation. And so I got to thinking, not only is that family impacted, but now what's going to happen to that teacher? Because they lost electricity, but they're willing, they're able, they're ready to go. Are they forced to take a day? Are they non-compliant and now they have, some type of something we have to deal with in that nature? And it might be easy to say, well, they can go to school and do it. Well, maybe their school is out. Schools get out, school power goes out. Sure, not every school has a generator, but many do. Or maybe they can't even get to their school, which is the whole experience with closure days, because teachers have to travel from the valley or come down the hillside, or whatever dynamic is responsible for the emergency closure might affect those teachers just like it's affecting those families. And then I got thinking, we are in a mindset of a pandemic where teachers are responsible for certain things online and we're kind of in a routine. But when we go back to a normal situation, gosh, let's all hope, right, that's coming soon. And we're back with subs. And I have a sub that day. How is a sub even going to be responsible or have access or deal with the responsibility of teaching these students and families online? And again, I'm giving examples of district-related issues, but again, it's going to just impact students and families because they are either going to be able to access or they're not. And if they're not, I don't know. There's so many what ifs we have to think through before we mandate some type of online learning experience on emergency closure days that we really can't even speak to because we don't know the nature of the emergency closure. So I just want to reiterate that I think in concept, this idea on paper sounds great. In reality, it's another program change, and as we have found out with past implementations of new or adjusting programs, we need to think more through it, and I think we need to collaborate more in terms of what that would look like so we're all on the same page when those decisions come down. So with that, I will give the mic back to Brian.
Or send down to.
Oh, Marnie,
Marnie.
you have something to share?
Thank you, Rick.
Sure. Hi, Marnie Hartill. Thank you. I just wanted to share. I heard last week, you were talking about uninterrupted learning, and that this is a new opportunity, and that we'd be reaching some better than none. And I recognize that the efforts and the ambitious, intent, the good intention. I've been reading a text, and I'll get to that later, but I think my biggest concern is about equity in students. As a teacher of information technology, I work in technology, it's my passion with computer technology. Now I can dial in and I can work with my students right now, but I'm really concerned about the students who, if it's a state of emergency, I remember back in March I was doing a Zoom lesson while the melt was happening, and my roof was leaking. My roof was leaking in my house, and I don't want to be non-compliant. I want to make sure I'm fulfilling the request that's expected of me. And if my administrator says, hey, you have to have sub plans, you need to have emergency sub kit ready, you need to be prepared for anything, I'm ready to go. I'm a Girl Scout like that, but I'm trying to figure out how I would have an emergency lesson plan kit ready at home. But I don't think it would matter, considering the most important thing is equity and access. Will families be prepared? I mean, we're thinking about this new idea, and how is the community going to respond? I think we need to take that kind of conversation to the community and see what parent and feedback might be. I grew up on a farm, and my parents would tell me to get out and go buck the hay or go shovel cow manure, and so I had a lot of chores to do. And when there was a storm, we're out there wrangling cattle. So I know that our students in Anchorage aren't doing that, but there may be a roof to clear off, there may be a driveway to clear off, there may be a fallen tree branch and wind. And when you're in a state of emergency, your family pulls together, and I'm really concerned about it just takes you back to the earthquake and being a staff member at Greening and being a Greening Colt. I remember seeing it in the living room, what it was like listening to fellow staff members in the one of the living rooms of our staff members, and hearing the news that our building we were not able to go back. And so we take it very personal. We have a lot of pride in making sure that we take care of our families and our students and their needs. And when it's a state of emergency, we want to make sure that we're thinking about equity and access. So I just want to leave my comments. This is very apt. This is a text called Failure to Disrupt. It's by Justin Reich. It's called Failure to Disrupt, Why Technology Alone Can't Transform Education. And it's by a leading researcher, Harvard University, worked with the MIT project on technology and learning. And there's a chapter on understanding the research of design principles for digital equity. And they came down with their research with 4 main themes: that we should unite around shared purpose, align home, school, and community, connect to the interests and identities of culturally diverse children and youth, and measure and target the needs of subgroups. And so when I look at this proposal, I'm really thinking about the impact on kids. The last thing I'm going to leave you with is, in all the research of technology and its impact on education, they found it does not democratize education. Just putting the devices and getting connected online is not going to make the biggest difference in learning. And it says, in this case and many others, implementation of large-scale learning tools runs far faster than the research needed to assess them. So I hope that you will look to what research supports this decision-making.
All right, I'll do my best to project because I know that I don't have the other microphone. We had a spirited, adapted PE session today at my school and did a lot of cheering because there was a lot of success with gross motor. So my voice is kind of going in and out because we had a day of a lot of fun and excitement with our APE students. My name is Michaela Kolarok, and I'm a special education teacher. I teach life skills over at West High School, and I taught life skills at the elementary level before that. I wanted to talk to two additions in particular, and I think they were mentioned by both Brian and Corey in 423. The first is the idea that we would do distance delivery in lieu of closure days. And the perspective that I'm speaking from, the perspective that I'm representing is a special education teacher, and I'm also a parent of a life skills student at South Anchorage High School. So I can't speak to everyone's experience, just those that are my own. Our parents engaged in a Herculean effort, I think, to come up with solutions that would allow everybody to be safe and for distance delivery to occur during the pandemic. And when I say our parents, I'm talking about the special education community. And they could engage in that effort because there was a roadmap, if you will, of what things would look like. So as a parent making decisions about childcare, how you're going to get your kiddo connected to Zoom, in the case of some of our kiddos who are in self-contained classrooms, and if you're not familiar with what that means, a self-contained classroom is a classroom where the needs of that learner are fulfilled inside of that space. And there's a tremendous amount of support typically provided to that population in the form of a ratio stipulation, teachers' assistants, and then specialized instructors like special education teachers or related service providers. In those types of environments, children can't simply just be sat in front of a computer and be able to successfully learn. It takes a tremendous amount of off-screen time on the part of the instructor to come up with lessons that can be delivered via distance. It also takes a lot of work on the part of that family, again, to see who is going to be sitting with that student, who is going to help them access the Zoom or other platform that might be mandated for that day. And I think that in the case of our special education students, it should be a huge consideration in terms of equity, because what we're asking for is that on the flip of a dime, to be able to engage in distance learning in a way that is meaningful and doesn't negatively impact their family. And I think for a lot of kiddos in our community, that's a really difficult ask. I feel blessed to be working at West and have the team that I have, and we did a tremendous job delivering distance education to our students, but it took a lot of effort, and it's not something that is a light switch for flipping on and flipping off. So I'd like to put those thoughts about considerations of equity and access into your minds as you're looking at the association's proposal. The second thing that I'm curious about comes in Part B, and it says that members are responsible for ensuring they have all equipment and other resources necessary to perform their job duties from their selected alternative work location. And I kind of have two trains of thought here. The first one is the entire purpose of special education is that we are providing a service that cannot be provided in a general education environment because our students require a tremendous amount of UDL, scaffolding, individualized education as dictated by the alternative curriculum that they're on or their individual education plan. Those materials are highly specific to the kiddos that we're reaching, and oftentimes they contain a lot of identifying information inside of them. So my question is as an educator, if I'm expected to bring all materials back and forth with me on the off chance that we do have a snow day or a weather closure or heaven forbid, an emergency closure because of COVID rates inside of a school, I want to know what kind of risk I'm taking on in terms of FERPA violations or potential FERPA violations, because I cannot guarantee that those materials will not be accessed by people who don't need to know that information. I mean, thank God that our computers can be locked, so there is that level of safety with any type of electronic information, but the nature of the materials that we're producing, the nature of the differentiation that we're creating in terms of lessons inherently calls upon us to have more identifying information than you might find for a general education student on those materials. The other thing I would ask, and this is my second point, is are we also going to mandate members of other bargaining units to bring home materials as well? So for example, I'm a life skills teacher. I am privileged to have paraprofessionals in my classroom who make it possible for my students to learn and for me to teach. Part of that process is they run data groups on a very regular basis because we are differentiating instruction for each student at several levels, which is often the case in a classroom where you're serving students from the ages of 15 all the way up to 22 years of age, well into adulthood. So will the district also be asking that our paraprofessionals bring home any and all materials they might need to run data groups on those days? And then what protections would exist for those individuals, again, for the potential for FERPA violations if those materials are accessed in error or on accident. I think that it's a good idea to consider ways in which we can prevent learning loss, because the goal of ASD, of teachers, of administrators, of everybody, is to create equitable access to education for all of our student groups, because we want them to be lifelong learners who've been enriched by their time in ASD. I just think, to echo the sentiments of Corey and Brian, there has to be, I think, some careful consideration and some thought to the way in which we achieve that goal. Thank you.
So last week, when I had asked about the equity of students, or mentioned the equity of students, Mr. Barker had said, well, it's better to reach some than none. And so, what I thought, as teachers, we're taught that when we think something is occurring and we're not real sure, that we go back and we really think about it, and we take data and we go back and look at things. And so that's what I did. So I went back into my online records and into my grades and the notes that I take and all that. And this is what I found when I went back and looked at that. I have 20 students this year. And during the time of online learning, I had 3 of those kiddos that completed very, very, very few assignments during online learning. And what I found out later on is because they were expected to watch their younger brothers and sisters. I had 3 other students who weren't able to attend Zooms on a regular basis. In fact, they tend to miss 3 or 4 a week because they had to go to a friend's house or to a relative's house for childcare during that time to stay in their bubble. There was no internet service. There were not devices available for them there. I had 2 whose parents had to work from home, and they didn't have a quiet space for the kids. So they basically told the kids, don't log on to Zoom because it needs to be quiet for mom and dad to work. I had 1 child that logged in regularly. Poor kid, man, he tried his best, but every time that child logged in, he either had siblings running around in the background. We heard fights between parents where I had to mute, so we weren't overhearing what was going on in that household. We had a television on all the time that he was on. So he tried really hard, but he missed a lot of instruction. So that was 9 students out of my 20 that did not have equitable access. 45% of my kids did not have equitable access. Then when I broke it down further and I looked at my students, of those 9 students, 7 of them are students of color. I can't agree with some is better than none. And I realize that if they have a device, that's great. But we are not able to address these other issues that go on in their homes. And we're not providing equitable access. And our goal is to shrink that achievement gap that we see. By hosting online learning for some, and not everybody, we're increasing that gap. It's detrimental. It's not helping.
I'm good.
You're good. Yep, you got it.
I'm gonna put it over. There we go. Hello, I'm Christian Hike. Thank you for giving me the chance to speak. What I want to focus on is the part of the district's proposal that says members are responsible for ensuring they have all equipment and other resources necessary to perform their job duties from their selected alternate work location. I'm sure the district agrees, and we can look back over the course of this school year and see how many times the district tried to bring us all back live, and then brought us all back, brought some of us back live over stages, because we all know that live education is superior to distance delivery. However, the teachers made a heroic effort, including myself, to try to perform distance delivery to the best of our ability and to provide quality instruction over a distance. So to perform my job duties, I regularly had this computer right here. I regularly had this Wacom tablet, which I spent $100 on. I had a document camera that I used to show the graphing calculators that I need to perform calculations in Algebra 2 and things like that. The students didn't know how to work them, but they had access to them in my AP Calculus class, so I had to show them how to use it. I bought that as well. I also bought online access to a certain math program where students could receive automatic feedback because the district's current materials actually predate the Common Core and do not have online access. So these are all the things that I did to perform my job duties. Now, whenever we are back live, my job duties are a little bit different. I still have to make up for these woefully out-of-date materials, and so I regularly construct these interactive lessons. Now, assuming that I pick up my phone at 6 o'clock in the morning when I wake up and I see that, live school has been canceled and I need to be able to go live at Polaris. We start at 8:15, so I need to be prepared to go live at 8:15. I just woke up, so I need to make sure that I have a space prepared to be able to teach these lessons. I then need to take the lessons that I have prepared to deliver live and scan them into something completely different. Oftentimes this involves Google Slides. I don't regularly use Google Slides live because I find that students work a lot better on paper. But I need to take my Word documents now and scan every little bit of them into Google Slides and then make sure that each of them is a Pear Deck lesson that students can then interact with. Now we get to the equity access. So assuming that I can do all of that for the 3 or 4 classes that I teach that day. A lot of times it's Algebra 2, Algebra 1, and AP Calculus. So I would have to do this in the span of an hour for 3 different classes. And then, who can access this? Now, I'll give you an example of one particular family that I taught this past year. They have 3 students at Polaris, and one of them is an ASD teacher. So it just doesn't work. Like, the students tried, they made a noble effort, but it couldn't be done. And so what I find myself pondering is, in the unlikely event that I am actually able to completely switch my job duties to perform these job duties from my selected alternate work location, then the students that are able to best access this quality lesson are the ones that are least impacted by the emergency closure that is currently going on. And the ones least able to access are the ones most impacted by the closure. So now I have a natural gap between students' equitable access to education, and we have widened that. So I'm completely mystified as to what is meant by the phrase "perform my job duties," and also how that impacts or benefits our students. So, thank you.
I'm good, thank you.
Hi, this one's kind of a hot topic for a lot of teachers. I'm going to be short and sweet because we beat this dead horse a couple times over again. I hope, dear to the educational gods, we're not taking that joy, that smile, that excitement of a snow day once in a while. And that's what I hear from the teachers, is you guys want to take the snow days. I hope that's not the case. If that's the intention of this, you just took 1 or 2 days of ridiculous amount of joy from kids, and I hope we all remember those snow days we had when we were kids. Thank you.
Thanks, Al.
Yep.
Okay, well, thank you all. There's plenty of passion. I'm not sure if the district meant to get folks stirred up over emergency closures or not, but maybe unintended consequences. Don't know. But anyhow, you have our proposal on 423 emergency closures.
But before we shift gears, Brian, you're gonna move to your proposal now, because that was really responding to the district's proposal.
Yeah, I think we've read through ours. Happy to answer questions if.
No,
I
just
want to
make a couple of
So that-
remarks
well, I guess-
before we move to
Sure.
your proposal.
Let me. The district and the old emergency closures article, with our current book article 423, really seems like it's more or less geared towards the shorter duration, kind of the we keep calling it the snow day type events, weather events, that type of thing. So I would just say that our edition, the new paragraph D, deals with longer term issues, but it would still come under the emergency closures kind of heading. So, but yeah, beyond that, happy to take any questions about anything related to 423 or comments, whatever.
I guess more initially, at least in the nature of a couple comments, because I want to first say that, I heard the passion. I mean, so it came through, so I appreciate that. The thing I would say that was resonating for me as folks were sharing their experiences, and well, I guess two things. One is, thank goodness that the superintendent and the board finally prevailed and got kids back into school, because what I was hearing was this emergency approach to education that we were forced into because of the pandemic was not ideal for kids. And so to the extent that any of the passion I'm hearing is attributable to the notion that the district regarded what we were forced into adopting in order to continue education during a time when students couldn't be in schools is in any way held out as some model for future instruction in the ideal. That's just not the case. What I heard was the tremendous energy that individual educators were engaged in to ensure that there was some, not ideal, but some meaningful educational benefit for all students. And there was quite a bit of focus on equity, and I know that was particularly challenging. And so I just am so grateful, and the district's so grateful that ultimately, because it's not true in other parts of the country, where special interests have continued to keep kids out of school, that dam broke and we were able to get kids back to school. That's what everyone was shooting for, and it took longer than I think that anyone, at least that I work with, hoped would be the thing. And the other thing I would say is this effort is simply an acknowledgement. This effort in the district's proposed changes to the article is an acknowledgement, as I mentioned the other day, that we believe, an opportunity to, in certain cases, limit, not in all cases. I mean, you can always find the student who, or a group of students who won't have access, and so I take, and I'm not dismissive of the notion that it's not a perfect solution for all students, or even a good solution for all students, and I appreciate the specific examples about that. But it's an opportunity that has come out of this whole exercise to prevent or address or mitigate the interruption of instruction for students, and we view that to be a good thing, understanding that there's a lot of planning that will have to occur as to how that will actually work. So this is not, this contract or these two sentences inserted in the contract by no means were intended to solve all of the issues that have been identified here as those sorts of scenarios that we'll have to be prepared for. The other thing, by way of clarification, is this is not intended to limit the flexibility, as I mentioned the other day, of AEA members to select the school location as their preferred location for delivery of services to students on a day when students aren't in buildings. That occurred, as we know, this year, that teachers access their classrooms and for a variety of reasons to do that. So the expectation is that would continue to occur. But that second sentence, or the final sentence in paragraph B, simply acknowledges that there will be those members who select a home location or some other location, and the expectation is that the work will be performed from that location, and acknowledging here that the intention is that there may be some flexibility for the district to define that work in a way that's been differently defined in past years. Specifically, we acknowledged last week that these days are days when members work, and it's just a question of what type of work is performed. And so if that alternate work location was previously a location where activities other than instruction occurred, the expectation here would be on those days when the district deems it appropriate to have the day a distance delivery day, that the member who chooses not to go to school would be able to do that work from the home or other alternate work location. Again, it's just despite what I've heard here, and I hear the passion, but it's still a little surprising in the abstract to me that there'd be such resistance to a model which intent is to address situations, particularly those that extend beyond a day or two, where instruction is meaningfully and significantly interrupted, and we have that capacity, albeit imperfect, as we've heard, to have that occur. So that I just wanted, before we move to the paragraph D proposed in the AEA proposal, to emphasize that this is about student outcomes. This is all about student outcomes. This is about trying to figure out ways to ensure, when we can, that we have maximum flexibility to continue student learning without interruptions. So that's the intent of the changes here.
Yeah, thank you, Matt. I think maybe the disconnect between the two sides of the room here is that you're talking about this in the abstract, to use your word, and folks on this side of the table aren't thinking about it in terms of the abstract. They're thinking about what the reality is going to be. What is it going to look like? And you haven't fleshed out the plan for these folks. It's what you propose. The initial proposal looks like a ready, fire, aim setup, and these folks see the pitfalls. They see that this is it's not there yet, and they see it, and their colleagues that are watching on YouTube, whatever, see it, and it's folks that read the initial proposal, that it jumps out at them as this is gonna be a mess. So anyway, I believe you've heard our concerns. You hold 423 now. Yeah. Corey has. No, it's not
Okay.
Corey.
Well, I just want to say that if you look at our proposal, it's not a no. It's a let's plan it out. Let's think through it and look at all the pitfalls. And it doesn't come across this way, but what it's really speaking to is a pre-plan. Because for every emergency, we have a pre-plan. But we don't have one for this proposal yet. And we need to come up with one. What it's going to look like, feel like, and sound like. So I just want to reiterate that our proposal is not a hard no. It's a collaborative model to help support students and families, because really that's what we need to think through, how we're going to do that.
And you're absolutely right. As I said, there's not that level of detail in the district's proposal, because this is a right that currently exists with respect to superintendent authority in determining whether or not schools close, and this was just simply an intent to acknowledge that we have an opportunity, given what we've learned this year, to on those days to continue instruction. So the details to suggest that there aren't details is not accurate. The details aren't in this contract language. That's accurate. But clearly, there would need to be a detailed approach to how this would occur, and I, those efforts are underway, and I don't have the details to share with you. As far as because you transitioned to paragraph D, I do have some questions about that. Number one, what is intended with the reference to an extended period of time? What does that mean from the perspective of the association?
Well, I think the existing language was, as I said, kind of geared towards what was typically 1 or 2 day closures. You can interpret it a variety of ways, I suppose, but my interpretation of our intent in D would be, a week or more.
So if the closure is going to extend for at least 1 week, then this committee process would be triggered?
Yeah, we did work out some sort of a threshold, I suppose. Yep.
I think I'm going to withhold further questions until we've had an opportunity to caucus in view of some of the comments here. Yeah, I don't have any more questions about paragraph D at this time.
Okay.
Did you have other articles or?
No. Oh, sorry.
I just wanted to respond to one of your comments, Matt, that there is a concern about teachers finding work or doing work on these days. They have plenty of work that they do on a regular basis that isn't done at school, that they're doing from home, that they have available to them. They transition very easily from their alternate work location because most of them almost always take home their laptops, and even if they don't, they have the ability to access material and information that can be put to good use in their job as an educator for the Anchorage School District. But the thing I really want to make the point about is when we did have our emergencies, which we all know these last few years, we've been hit with them like, we haven't ever that I know of since 1964, with the earthquake and then with the pandemic. And the hours and the work that teachers put in to do all they could to help get our schools back up and running. I look at those teachers whose classrooms were just trashed after the earthquake, where their schools were trashed, where their colleagues' areas were trashed, and everybody pitched in a way that can only make you feel so good about the work that was done. And I'm not just talking this side of the table. I know it came from that side of the table. It was all hands on deck. And with the pandemic, I think the same applies. Teachers got ready for their classrooms and to go back repeatedly, even when the virus kept that from happening. There was just a tremendous amount of work. All hands were on deck to do what they needed to do to deliver instruction. And when the numbers became a little more tenable and vaccines were closer, then schools opened back up. And no one's been happier about that than your teachers, at least the hundreds of them that I talk to.
So if we're good on 423 for a moment or two, we could talk over which articles we'd like to go over tomorrow, and maybe you could as well, and maybe you could, and I'm talking about in caucus here, maybe come back with something on 423, hopefully. But anyway, we'll spend time coming up with a couple articles to open tomorrow, and it might make more sense. We started on 421 last week, and we mentioned that maybe it'd be good to have 421 coupled with 419. So if maybe if you had a response to 421, then we could put together maybe some sort of a we could pair those two together in a way that makes sense and send them back to you in that manner. So we would probably hold off on starting 419 right now. Yes, I think also last week we talked about signing everything was book, and then we still haven't had time. We haven't been able to go through the housekeeping and kind of verify that we really think it's housekeeping. But at whatever point we do that this evening, we do it tomorrow, whatever. At least on the articles that are booked.
Yeah, I believe we prepared. I mean, I'm happy to provide the articles that I referenced some point during when we last met.
Yeah.
If you want to review those.
Looking at the clock, we're coming up on 6:30. Maybe a caucus now, and maybe let's sign those tomorrow. It'd be nice to see if we can get some more on emergency closures and try to get some work done. You and I can sign the book stuff.
Yeah, well, we'll pull them together I mean, I've got a stack of them. I can, if you want, you can take them with you tonight and look at them.
Sure. Okay, great.
Yeah.
Thank you.
So what do we want here? Come back at 6:45 and talk for a few more minutes?
Sure.
Okay. Yeah, sure. I think just one packet, right?
Yeah.
I think so.
Glenn and Debbie should have thought about that.
Yeah, Glenn and Debbie said, I guess
Which
I
when
should've-
when she told me, I'm like, are you
I
kidding?
know she's more upset about it than me.
through withdrawals, okay?
Yeah, I know.
No, I'm not. I mean, I am, yeah, but, you know, there's a lot of stuff that needs to be done,
Yeah.
you know?
And
it'd
you
be
know me, I'm
nice.
just like, I don't care where I'm gonna go, just like,
Anyway.
whatever.
You know, frankly, I want to have some conversations about transit. There's lots of questions I have in my mind. How we're going to do certain things, how we're going to, you know, so, because ideally,
It's not like I'm in Fairbanks now.
no,
I'm gonna be saying that.
I'm just feeling like even now with this office
He is not gonna live
situation,
that down. I'm gonna remind him of that forever.
and
It's
I
not
almost-
like I'm in Fairbanks,
I
Glenn.
know. I'm gonna have,
Or
I'm
Kenai,
glad,
where I could
didn't.
be.
I'm glad I didn't go with my initial snarky remark.
I just thought it was funny.
And then I'm like, okay, I'm on the high road on this one.
Because I'm sorry. God, Glenn, it's not like I'm in Kenai. So do remember, he gave me permission to start my office
That
day
mics are
Tuesday.
hot, thank you.
Oops, sorry. On Tuesday. Yeah. Because I'm gonna drive.
Are you gonna be there on Monday?
No, that's what I said. I'm coming back Tuesday because I told Glenn originally to fly back on.
Sign something every day. Every day, every day.
All right, do we have everyone back? It looks like. Okay, appreciate the timed break. We did have a chance to have discussion around 423. Of course, we had two proposals, the districts and the associations. We have come back with another proposal, and that would be to return to book. So the reason for that is, understand the concern that people talked about in terms of what the intent with the additions of language. This is language we're familiar with, that being book. It's been in the contract. So responsive to that, and then with respect to proposed paragraph D, the district views an emergency closure decision to be, squarely within realm of educational policy, superintendent, with input, of course, and consultation with the school board in relation to any sort of longer closure, but certainly one that is within that authority and should remain in that regard. So we understand the interest, but are not inclined to accept the proposed paragraph D. So the counter proposal would be to return to book on that.
Okay, thank you. And as a formality, are you handing us a book?
Yes.
Thank you.
You got any more over there?
Okay, well, thank you, Matt. We'll talk about that. Get back to you on that hopefully tomorrow. So, maybe we could take a look at a bit of a roadmap for tomorrow. Do you have some articles you want to talk about?
The district would propose Article 120, salary adjustments.
Okay. And yeah, our next articles that we open would be 463 and 464.
Okay.
Did you say 150 or
120.
20.
And I'll just sign those down. Okay.
And I am, just so I can have them ready for you, Brian, just signing the ASD side of the.
Yep. No worries. Thank you.
Yeah.
Ready? Ready? Yeah. So. That's fine. I kind of put my head down and was signing. Are we? Oh, okay. You're all set.
Untangle myself later.
You good? But it's, he's got, these are our copies. These are our copies. So, I can sign them, but we don't all need to be here for it.
We're good?
Yeah, I believe so. Thank you. So, I think we're probably good for this evening. Thank you, everyone, for your time. Appreciate it. And we'll see you tomorrow.
Tomorrow.
Same place, same time. Thank you.
Thank you.